Hello, my name is Victoria Alexander, and this is my presentation on organizational culture. Organizational culture is defined as a management concept that reflects the shared attitudes, beliefs, and perceptions surrounding an organization's principles and practices. It shapes how physicians, nurses, ancillary staff, and other healthcare professionals work together to accomplish goals within the healthcare settings. Organizational culture encompasses leadership and management behaviors, policies, standard procedures, and the expectations perceived by employees. It also includes the organization's missions and values. This is also synonymous with work culture. These collective values and beliefs ultimately create a work environment that can either support or hinder collaboration, performance, and overall effectiveness. And every member of the organization needs a strong work culture to maximize their potential in taking care of patients. A positive work culture fosters growth and progression for the staff, thus resulting in growth for the organization. A negative work culture fosters a loss of cooperation and poor collaboration. And organizational culture must be assessed and improved to impact staff, management, organization, and patient outcomes. The impacts on nursing of organizational culture. Nurses make up one of the largest professional groups within healthcare organizations. Therefore, nurses have a very important role in determining workplace culture. Organizational culture attracts and retains healthcare professionals because workers typically will seek a workplace where they feel wanted, valued, and have opportunities to grow and agree with the organization's values. And also, a modern environment that promotes continuous education and collaboration ensures employee satisfaction, which has a positive impact on the quality of care that patients receive. Organizational alignment impact. The organization's mission describes how it will fulfill its vision and establishes a common course of action for future endeavors, while the values are strategic guidelines for decision making to achieve the vision and the mission. Organizations must develop communication, rewards, feedback, and involvement in decision making in order to have better outcomes. Management practices, along with mediating factors such as the communication and feedback that's listed above, will influence nursing leadership on staff, organization, and patient outcomes. The strategy implementation framework can guide the introduction of organizational interventions, and there are 4 steps in this framework. The first one being strategic content that outlines the desired plan for organizational interventions. The second step would be strategic context, which describes the internal and external factors that affect the implementation of the plan. Third is operational process, specific activities of implementation within the organization, such as outlining costs. And lastly, the outcome. It is a very critical component, and that leaders will assess whether strategies were effective and if the desired change was achieved. Nurse leadership impact on organizational culture. Nurse leaders are expected to foster a safe and healthy environment for their nursing staff. The nurse leadership impact is affected by the distribution of power, their established relationships, the level of trust between them and their staff, and then between them and the administration, communication style, and their approach to decision making. It must be consistent with and actively reinforce the organization's culture. It is essential for achieving healthcare goals and delivering high quality patient care. And their impact also ensures the organization's values and missions are reflected in day to day operations. There is also a need to develop culturally conscious management in complex institutions such as a hospital. Other impacts that organizational culture may have. The organization and the leaders must ensure that nurses have a positive work experience. Ways that they can help manage this is to manage the workload balance and to help minimize fatigue upon nurses. Nurses may feel a loss of morale when they cannot meet patient care needs due to time pressure from management or leadership, uneven workloads, and increasing administrative duties. Organizational leadership must prevent burnout and reduce risk of errors. And also, patients are more likely to seek care at institutions where they feel that teamwork is evident among staff and that there is stable leadership. This also makes them more compliant as they have increased trust among the staff. Limitations and utilization of resources. So, a limitation that an organization may have may be the number of staff that they employ, staff competencies and skills, and leadership models such as shared governance. Um, Leadership is expected to have diverse expectations. So, future leaders may need training to develop their leadership skills. Leadership should establish shift scheduling practices that provide adequate rest between shifts, that allows enough time for staff to safely transition between day and night rotations. That's a limitation because we can't change time. Nursing recruitment is to maintain quality of care. We need knowledgeable nurses, professional nurses, and also continuous education. So these kind of go hand in hand. Programs for professional development and continuous education. And due to rapid changes in healthcare, ongoing education is also necessary to stay up to date with advancements and best evidence based practices. And this allows for career advancements also. This is also going to help attract and retain employees. These are the four references that I use for this presentation, and thank you so much for listening.